Health officials say they finally have a breakthrough in finding the source of dozens of deaths and thousands of illnesses related to vaping. The CDC says it found vitamin E acetate in lung fluid samples taken from patients in 10 different states. But agency officials say they cannot rule out other toxic substances, and it may take additional testing to clearly show vitamin E acetate causes the lung damage that's being seen. Dr. Jen Caudle here to break down what this all means to us. We just keep hearing developments.
Yes, we do.
And the situations that happen
Yes,
here.
we do.
Dr. Jim, we do know vitamin E acetate alone is just not the sole culprit so far.
We don't think it is, right?
Okay.
So you're right that we found vitamin E acetate in the lung samples of 29 patients. Now that's news in and of itself because we hadn't found a substance in lung tissue thus far. So this is the first time that's happened. 29 of those samples, all 29 showed vitamin E acetate. But you're right, Lauren, it could be more substances, not just the vitamin E.
Can you explain to us what is vitamin E acetate?
That's a great question. So vitamin E is often found in a lot of different substances. I mean, things from like skin creams, right, that are enhanced with vitamin E, to vitamin supplements. You go to like vitamin stores and you see supplements with vitamin E.
Right.
The thing about it is when we use vitamin E on our skin or we use it in a pill form, it's not a big deal. But we also know that sometimes vitamin E acetate, the oil, can be used to make some of these vaping oils, like they can be used to cut them or enhance them or augment them. The problem is you can't inhale vitamin E acetate. That's the thing. You can put it on your skin, you can put it on your face, you can take a supplement, but you can't inhale in your lungs. That's a whole different story, and that's what we think we're finding.
Gotcha. So changing kind of the element is
the
really damaging.
The form of it and how we take it in. That's exactly right. And again, as you mentioned, there could be other substances, but this one has been linked in all 29 cases that the CDC has studied so far. So it's strongly suspected that this is playing a role, a big role.
And so some of the other things that are in these vaping devices and vaping pens can also be problematic as well.
Absolutely. You know, we've talked about e-cigarettes and vaping for years. We know it's an epidemic among young people. And one thing I've always said is that in normal e-cigarette, liquids, there's a whole bunch of chemicals, many of which we don't know what's in them. Now, we need to keep in mind, I'm going to just sort of digress for a little bit, that in these sort of e-cigarette and vaping associated lung injury cases that we're talking about, many of the people have vaped THC. Not all of them, but THC has been involved a lot in these lung injury cases. So I want to draw that out as well.
Dr. Jen, when people are they're coming to you and they're saying, I want to stop smoking, and that's what the vaping devices were intended for, and then the younger kids kind of, they were appealing to them. What's your suggestion for people who really want to like pull away from smoking?
Yes.
Vaping just seems dangerous.
Okay, well, honestly, right now, I'm not going to lie to you. I think it is risky. Let me tell you what the CDC says, first of all, so people know, okay? First thing is CDC says do not vape any THC products, okay? Don't vape THC, which a lot of people do. The other thing is don't buy your vaping devices and vaping sort of equipment off the street or get them from a friend. Those secondhand sources, do not do that. The other thing is, there could be other substances, there could be other factors. The CDC says, look, if you want to sort of reduce the risk even further, don't vape at all, because this is still sort of an ongoing investigation, quite honestly. But to your point, a lot of people want to quit smoking. Remember, vaping is not even FDA approved for quitting smoking, although many people have quit with it. There are FDA approved medications, there are nicotine replacement substances, etc. I say talk to your doctor, because we've got some tools and tricks that may be able to help you. So don't give up. Don't let this get you down.
Okay. You're so great.
Oh,
I love it.
you're sweet.
Love
You're so
having
great
you
too.
here. All right, quick break, and we will be right back.